Preventing abuse through the practices of trauma-informed care. He heals the brokenhearted and binds up their wounds. Psalm 147:3. To prevent abuse, one must meet the injured and victimized child where they are, to encourage healing and to empower restoration. Slide 2, the quiet hurting. In an earlier presentation, information was shared with you about the effects of abuse on children who witness such adverse conditions in their homes. With that, there arises a need to prevent further instances of abuse from occurring. It is postulated that this effort can be achieved through the use of trauma-informed care. First, let us agree that the children who witness abuse are in fact the quiet hurting. While they may not be directly subject to abuse, they are witnesses. They see and hear the assaults made by one family member onto another, and/or they witness and experience trauma in the aftermath of domestically violent incidences. Yet there are beliefs that minimize these evidences. One such belief is that children are shielded because they are sleeping or playing outside at a time of an abusive altercation. However, children can often provide detailed information about domestically violent incidences in their home, even though they were thought to be sleeping or outside. Another belief is that children do not know that abusive assaults happen in their home if they are not there during an incident. Yet even when children are not home, when a violent event occurs, they are affected because they are often interrogated before and/or after an event by the abusive parent about the activities of the abused parent, in a measure for the offender to gain information that can be used to exert control over their spouse or their partner. The child is used as a spy without their willing participation and oftentimes with their unknowing participation. Therefore, the child remains a quiet witness who is negatively impacted. Aside from the many false beliefs about domestic violence, the fact is that witnessing violence between one's parents or caretakers is the strongest risk factor of transmitting violent behavior from one generation to the next. Excuse me. In slide 3, hurting people hurt people. Recognizing that, it can be concluded that hurting people hurt people. Children who witness domestic violence are hurting. They want the pain to stop, and/or they want others to feel their pain. It is from this knowledge that it becomes clear that the risk of adverse responses increases as children are exposed to parental abuses. These adverse responses can appear in many ways, including an increased risk of committing or attempting suicide, increased incidences of bullying others, and an increased decline of employing effective coping skills. Also, there is an increased risk for child witnesses of abuse to present symptomologies of post-traumatic stress disorder. Children with post-traumatic stress disorder are notably anxious, whether repressed or expressed, after witnessing a traumatic event that is perceived as highly threatening, and it is an event that does not have to be experienced directly. Additionally, it is cited that among other symptoms, children with PTSD often demonstrate negative beliefs about themselves, exhibit inappropriate blame, and/or are emotionally detached, irritable, or reckless. While this presents a few of the negative responses that can occur as the result of a child's exposure and witness of domestically violent behaviors, it is clear that an effective means of helping child witnesses is important to their overall care and to the potential of achieving successful healing and restoration from the harms that they've endured. So what is trauma-informed care? Slide 4. While Scripture incites parents not to provoke their children to wrath, but to bring them up in the nurturing and admonition of the Lord, some parents entrapped in the cycle of abuse cannot effectively help their traumatized child. They may not even realize the negative impacts for what they are. Therefore, it is then up to the village to help nurture and raise the child. One of the best methods a village can use to nurture and raise up a child who has been traumatized by witnessing domestic abuse is the trauma-informed care methodology. Trauma-informed care is a practice of mental health care and healing that could be facilitated to overcome the adverse effects of traumatization. Foremost, this therapeutic approach is trauma competent. Caregivers seek to understand trauma conceptually and individually, and it begins its applications through the delivery of safety as given by and from adult caregivers and/or professionals. These professionals need to recognize that without an instilled and sincere perception of safety, the injured child will not change their behavior, nor will they listen to new concepts of coping to receive that help that they so desperately need. So this treatment process involves using understanding, commitment, and organized practices of addressing the trauma-based individual needs of those who are receiving services. This methodology is versatile, as it is easily applied at various stages, times, and levels of traumatized need. For instance, this treatment is applicable in hospitals, shelters, correctional facilities, and so on. It can be delivered before, after, and during traumatizing experiences as a preventative technique or a measure of mental health triage. Additionally, this form of intervention and care can be utilized in various capacities, from intake processes through support groups, in treatment centers, at school, and in churches or any agency or organization that works with the best interests of the well-being and care of people as their foremost priority. Excuse me. Another aspect of trauma-informed care that is useful is the fact that this methodology respects the needs of the child witness, based on an understanding of their history with traumatic experiences, and intervenes in a way that quickly builds effective rapport with the individual. Slide 5. Moreover, the framework of trauma-informed care has been noted by various studies to be effective in treating PTSD, as it appears in all age ranges. It is also effectively combined with the methodology of CBT, or cognitive behavioral therapy, in application to treat persons who have experienced significant, complicated, or complex trauma. Additionally, trauma-informed care provides flexibility within fidelity while addressing treatment of attachment, self-regulation, and competency limitations that occur as the result of traumatic stress. Slide 6. It can be surmised that childhood trauma in and of itself is a significant public health problem, and its effects have global consequences. So it's up to our grassroots ministry, being first and foremost a human services provider, to take on the twofold task. First, to destigmatize the negative impressions that child witnesses of abuse have of adults and the inappropriate behaviors thereof as a result of witness violence, and for the mission to offer a child a chance to heal by attending to the continuing impact of trauma upon these quietly hurting witnesses. They need to feel safe and gain a better sense to live meaningful and fulfilling lives. Thus, the challenge is before us. As Stephen Berkowitz and Joel Fine indicated in a study on children experiencing traumatic stress, it is important that the social and emotional supports are key protective factors in preventing negative PTSD psychological symptoms and disorders. We need to make that crucial step to meet the needs of victimized children by being a known and caring adult who is committed and who can be understanding. It's important during all stages of the abuse cycle by offering these details. We can and need to be committed to listening to the child, to sharing time with them, and to understanding them in an effort to provide care that is informed about their traumatic experience. We can help the quiet hurting child so that they're given a chance to learn how not to hurt within themselves and outward toward others. We can and need to be those mentors who help the child witnesses as they process the harm that's been done to them, and to show them that God intends to do good so that they and others can be saved and know that blessed people bless people. Thank you.